Hey,
You are now live.
thank you, Asha. Welcome everyone to tonight's FBS Chat with Kate Kowalski. Have I said Kowalski? Is that right, Kate?
You're correct. Yep.
Thank you very much. And Gil, you all know Gil by now.
Hi, everybody.
um, and Kate, thank you for joining us. So generally, I like to understand people's journey into the solution focused approach. Uh,
hmm
and we know that you were there with the original team, but what led up to that?
Yeah. Well, first of all, thank you all for having me. I have watched numerous of your chats over the last few years and have really enjoyed them and learned a ton. And so thank you. I'm really honored to be with you. Yeah, interesting journey. I I grew up with both of my parents working at a private psychiatric hospital. My mom was a psychiatric nurse, my dad was a pharmacist. My mom actually was quite a pioneer. She opened one of the first psychiatric day hospitals in the country, in Milwaukee back in the 1970s. And so and my mom was somebody who was very passionate about her work. She brought it home, would talk about, back then people referred to as patients, but talked about her clients. And I was really inspired. And so from a relatively, youngish age, I knew that I wanted to be a therapist. I felt like the work was important. It seemed really meaningful. It seemed like it had the power to have an influence in people's lives. And it's funny because one of the a person that consulted with her team was a guy by the name of Elam Nunley, who was a professor of social work at the University of Wisconsin in Milwaukee. Now, those of you who are very familiar with the very early days of the Brief Family Therapy Center and the development of solution-focused work might recognize Elam's name. At the time, I just knew him. My mom would come home and over dinner, oh, Elam was there today, and this is what we talked about, and blah blah blah. Well, I then went on to do a bachelor's degree in social work at the University of Wisconsin in Milwaukee, and who was one of my professors but Dr. Elam Nunley. So I started, with a basic family therapy course and that kind of thing, and so that was sort of my first introduction. Although at the time he wasn't necessarily in that context teaching brief family therapy, solution focused work, but it was, but I knew I wanted to be a family therapist. And so went on and did my graduate degree. And my first job was at a county mental health center in a community about 45 minutes or an hour north of Milwaukee. And there was another person who was hired at the same time I was, whose name is Barbara Lindquist. Now, again, some of you may be familiar with that name. Barbara Lindquist, who remains one of my best friends, is married to Alex Molnar, another early name from solution-focused work. Alex had previously trained at BFTC and had stayed on as a collaborator. He was a professor of education at the University of Wisconsin in Milwaukee, but had gone back to do a master's in social work, had this interest in family therapy and specifically what was developing as solution-focused work. Barbara, who was a social worker, she had also trained at BFTC a year or two before I ended up doing it. So all of that is to say, Barbara and I were hired at the same time. We became fast friends. We commuted together, which meant driving hour both ways. And during those car rides, we would talk about our work and the clients we were seeing. And at the time, I was training at the Family Institute of Chicago, which was a very well-regarded, very well-respected 2-year training program in family therapy. And I was enjoying it, but I was also starting to be influenced by what I was hearing from Barbara as we were, on our car rides back and forth, and thought, maybe there's something to this brief family therapy stuff that I want to be learning about. And so I ended up finishing the first year at the Family Institute of Chicago and decided not to go on for the second year. And instead, I transitioned over to the training program at BFTC, which was an intensive year-long program. By intensive, we would meet every Wednesday from 1 in the afternoon until 9 in the evening. And the first part of that training would be kind of didactic, either quote unquote lecture style or reviewing articles or watching videotapes or discussion of different topics. And then the evening portion was seeing clients. And we were in teams, and I was tremendously blessed to have Eve Lipchik as my primary supervisor, along with John Walter. And so I know I've been rambling here, but that was sort of and it just felt from the very start like I was home and like I was in a place where and I had tons to learn, obviously, but I just felt like this made sense to me. All the baseline assumptions of the work, and then just what I was experiencing in terms of how the therapy was being conducted. It just struck me as very respectful, and at the same time creative and interesting. So there you go.
Oh, I don't know where to start. I've got a few questions. First one, when we talk about social work degrees over here in the UK, it's kind of, it's more around safeguarding, keeping families safe. It's not so much about the therapy side of things, and I don't know if it's different in the US. So I think my first question is why family therapy in particular? What was it about the family side of things that drew you to that?
I was just always really intrigued by, and it might have been just being intrigued by my own family, and how, I grew up with one brother who was just a year older than me, and we were very different people. And I kind of was always intrigued, like, okay, same house, same parents, same family, and yet two very different. So I think I was intrigued by that. There was something about the systemic nature of family therapy that really made sense to me, that we exist not only within ourselves, but within this other context, and the family being of just a very highly influential context. Maybe it was some of the early work with, as a student with Elam Nunley and learning a bit about families that was just really, I think the power of families and the power of that influence just really struck me.
And definitely with you on that, because that's when we started out, we knew it had to be a family intervention. It couldn't be people in satellites. Like you say, that systemic nature of it. So just before I bring Gil in, just one. So you're at this prestigious kind of course in Chicago. You're driving to work. Was that a risk to end that? What was that? What was that thought that I need to change course? Because I don't know. It sounds like the course that you're on was quite prestigious. So was that a risk?
Oh, that's interesting. I mean, while the Family Institute of Chicago, I mean, you're right, it was a very prestigious program. I guess at the time I wasn't really thinking about it in those terms. I was relatively young. I was in my mid-20s. I mean, I was like, what felt important to me at the time just was to go with what kind of felt right to me, I guess. And maybe initially, maybe I wasn't thinking about it in exactly those terms, but that might have been what drew me to the Family Institute of Chicago. I mean, I knew that that was a very well-respected, well-regarded program, and it was in proximity enough to Milwaukee that, yeah, that I could drive there. And now I don't remember if that was once a week or every other week or whatever the cadence was, but I didn't necessarily view it as a risk to switch over to BFTC in any way. It seemed like I knew I wanted to work toward the credentialing to become, and at the time there wasn't licensure in Wisconsin around marriage and family therapy. There is now, but I knew that I wanted to, be a member of AAMFT, the American Association of Marriage and Family Therapy, and kind of follow that path. But yeah, but I have to say, no, and no criticism of the family therapy training I was experiencing, but definitely switching over and deciding to do the training with BFTC was life-changing in so many ways, that I never look back, and no regrets.
Cool. Gil, you must have questions.
Kate, about what years were these that you're talking about?
Yeah, so I started the training at BFTC in 1985. So I was with the 85, 86 cohort. And then kind of nearing the end of the training, my dear best friend, Eve Lipchik, took me for breakfast and was talking about how, BFTC, they were looking to grow a bit. And I thought, well, that's really cool. And, I wasn't quite sure why we were having this conversation, but I thought, okay. And then she invited me to join the team. And I remember feeling this urge to look over my shoulder and say, who are you talking to? So I ended up then working at BFTC from 1986 to 1988.
Okay.
Yeah.
And you got your MSW at Wisconsin, Milwaukee?
Madison.
Madison. Okay.
Yeah.
Were they teaching any family therapy classes there?
Interestingly, I should have actually done things the other way around. In terms of maybe if I wanted to go to two different schools, it would have made sense for me to do my undergrad in Madison and then come back to Milwaukee for graduate school. Because the truth is, UW Milwaukee at the time was had a really robust, really very excellent family therapy training. I mean, there was a number of the social work faculty were very engaged in the family therapy field and had a nice program. But I later ended up teaching there as an adjunct faculty member, and then I actually worked there for several years, and had the opportunity to teach family therapy courses. But yeah.
Well, I know Elam Nunley came there from Minnesota.
Yeah.
And in Minnesota, he developed or co-developed something called Minnesota Couples Communication Program.
Yeah. Yeah.
And I know about that because I was teaching at University of Iowa then in the social work.
Okay.
One of my colleagues, Patricia Kelly, was from Minnesota, and she had him as a professor. I knew about the work from her, about his work, and then he went to Wisconsin.
Yep.
At Milwaukee. In comparing the Family Therapy Institute program in Chicago to BFTC, was there a difference in theoretical orientation? I mean, they were both focused on family therapy, but of course, BFTC was influenced by Gregory Bateson's cybernetics and Milton Erickson's hypnotic techniques. What about Chicago?
Chicago was kind of teaching. It wouldn't be fair to say. I was tempted to say hybrid. That's not really the right word. I feel like at the time we were learning kind of a number of systemically oriented approaches. You know, I mean, there was some structural, there was some psychodynamic. I mean, it was kind of the prevailing. It was kind of more of an overview. Now, my guess is in the second year, maybe there would have been some greater concentration, depending on, you know, the supervision, the supervisory match, and that kind of thing. But I was intrigued really in shifting over to BFTC by, you know, just the solution focused approach that had evolved.
Mm-hmm.
So, and that was something that I wouldn't have been getting in at the Family Institute in Chicago.
Uh-huh.
Yeah.
As I've gone back and read Eve Lipchik's sort of her writings on the beginnings of the early days, it just sounds like a very exciting, heady time for everybody involved.
Well, and that was part of, I think, what really drew me is, even though I think the approach, and I know in the conversation you all had with Eve a few years ago, you know, Eve was able to talk about sort of that evolutionary process of development of solution focused work. And I think by the time I was there, you know, things were still evolving, but much of the approach had really been coming together, and Steve had been writing and you know, both a number of the early papers had been published, and then, you know, Steve's first book. So I think that was still happening, but now they were at a point of, you know, doing more teaching, doing more disseminating. There was more focus on application of the approach, I think, to help people understand that this was an approach that could be used, you know, across a spectrum of, or with a broad base of clients and kinds of client issues and that kind of thing. But what was still there, though, and was so exciting to be part of, both as a trainee and then as part of a member of the team, was still that sort of collaborative, team-oriented, you know, the behind the mirror stuff, you know, those kinds of collaborations and conversations that were still happening. And it was just really exciting. It felt like being part of something that was really emerging and was going to be something, although I don't know that anybody could have imagined, you know, now 40 years later, what it's just all that is out there, and this huge worldwide community of solution-focused practitioners. From, you know, when I think about sort of those humble beginnings.
Well, you know, I mean, even then, family therapy writ large was still kind of new. It still challenged the mainstream mental health establishment. And then when you add the solution focus with emphasis on strengths rather than deficits, that really is revolutionary.
Yeah. Yeah. And the whole notion that you really don't have to understand the problem in order to, you know, help people find their way forward in terms of a solution or whatever language we want to use to describe that. That was pretty revolutionary.
So now I know. Let me ask one more question here, Joe. And then
go on.
I know you co-authored a paper with Eve Lipchik and Elizabeth Searles. Came out in '93, titled "A Consumer's Perspective on Domestic Violence Interventions."
Okay, you're taking me way back. Yeah.
And I know Eve is known for her work with couples where there's domestic violence, but it sounds like you were in on the ground floor of that as well.
Yeah, nowhere near to the same degree that Eve was. And they were very kind to have me be part of that paper. It was really, I was one of the clinicians who was working on as part of that project. And again, it was really fascinating to be learning from Eve about, the ways in which she was looking at and working on applying these ideas within a specific population around domestic violence. And Beth was a professor at UW Milwaukee at the time and was a wonderful collaborator.
Yeah, I just wanted to ask, Kate, I know you said you were there for a year between 85 and 86, and you did the and solution focus was evolving. What was it like in that year? What stood out for you? What was your, I don't know, standout moments?
Oh, wow. Yeah, I mean, there are numerous. I just I'm remembering the times being behind the mirror, and being part of the team discussions and hearing, whether it was Steve or Insu or Eve or John Walter or Jane Peller or whoever, the banter and the conversation that would go on, and then the decisions about when to call into the room. And again, those were days before we had cell phones and all of that. So there was physically a phone in the therapy room, and one behind the mirror. And so, there were times when, Steve, for example, would just pick up the phone and call in a question. And of course, those moments being, I remember just the fear of the first time being in front of the mirror and hearing, and then thinking, okay, am I on the right track? And then hearing that phone ring. And of course, clients were aware that this would happen. They all provided their consent and things. And so, going and picking up the phone and being asked to ask a question that seemed a little bit out of left field, but thinking, okay. And then, seeing the way it would develop. I guess I also remember although at this point I was actually working at BFTC, but there were times I would go into a room and to work to, see a client or see a family and not know that whether or not somebody was behind the mirror. And again, clients were aware that this might sometimes be the case. But I remember one time coming out of the therapy room and into the team room. And when I went in, nobody was there. But when I came out, Steve and Insu and Elam were there. And I kind of looked at them and I said, well, and Steve said, not bad. We'll keep you. You can stay around. And I thought, okay, well, that was pretty high praise, I guess, from Steve. So yeah, those are some of the things. I remember Insu doing her stretches or her yoga behind the mirror and, just quirky things like that. Another thing, though, that really stands out, Eve was such a master with words. And, so that was at a time when, and I know, people are practicing solution focused work a bit differently now, but at the time we would pretty regularly, very regularly, take a break at the end, do like a 40 or 45-minute interview, have a conversation with the family or with the client, and then leave the room and either go talk to the team or, once I was working on my own, just taking some time on my own. But back as a trainee, I remember just how powerful that experience was. And Eve was just remarkable at helping to construct and word messages in a way that were just so precise and just so impactful, that when we go back and deliver and really demonstrate her compassion and empathy and understanding of even the unspoken of what, clients had been communicating. And just the power, both from a learning experience, but then also, interacting with the clients around those messages was really powerful for me.
And you were at BFTC for 2 years, is that right, Kate?
2 years after the training, so 3 years in total.
So what was your next journey after that?
Well, I left at in 19, and I know you've talked to other people at various points about what a small operation the BFTC group was, and I got to a point where, to be honest, I needed to make more money than what I was earning at the time at BFTC, and so I left. Not necessarily because I wanted to, but pragmatically, I was supporting myself, and I needed to have health insurance and, be sort of a responsible adult and things. And so I did go on to take a position at the Counseling Center of Milwaukee that was really fascinating. The organization doesn't exist any longer, but it was an organization that provided low or no cost counseling services to the Milwaukee community, and did so by it was a wonderful training site for graduate level students, either in social work, family therapy, counseling, or psychology. And so I took a position there as the program director, so a bit more of an administrative role, but also I was able to help train therapists and do supervision, and also continue to see clients. And then about 18 months later, I ended up moving to Sydney, Australia, and joining Michael Durrant in his practice. So one of the things that was really influential about the time at BFTC was just, it was a time of collaboration, and people would sometimes come and want to learn from, the team at BFTC and learn solution focused work. And so there had been a number of therapists from Australia who had come over, and they were people, and there were, a number of people who were working with Michael White and learning about narrative therapy, or were practicing narrative therapy. And so more and more, I was starting to hear about some of that work, and found it really interesting and intriguing, and felt like it seemed to me like it was complementary in some ways, or there was a capacity for it to synergize with the work, with solution focused work. And so while I was still working at BFTC, I traveled to Australia for 5 weeks and just visited a number of different therapists who most of whom were doing narrative work, but not all. But I was really intrigued just to learn about the therapy, family therapy or otherwise, that was happening there. And that's when I met Michael Durrant and just had an opportunity to spend time with his training program. And Brian Cade also lived in Sydney at the time. And he was good friends with Steve and Insoo and Eve. And so I was able to spend time with him. And then time in Adelaide with Michael and Cheryl White and other therapists there. So I was kind of enamored with what I was learning there and found it just really energizing and exciting. So that was in 1987. I came back and, continued on with my life. And then to be honest, I was on the verge of turning 30. I had recently ended a relationship. I thought, well, now what am I going to do with my life? And the first thing that popped into my mind was, well, why don't I move to Australia and, see what happens there?
That's great. That's great. That's what younger people need to do, things like that. Do it when you're young.
Yeah. And I sort of surprised myself. It was like, well, that's interesting. But then the thought kept brewing, and Michael Durrant had said that he would. I don't even know where that conversation had started, but we ended up talking about me joining him in his practice, and all the paperwork and all the visa stuff and all of that took several months, but in 1989, I ended up moving to Sydney and joining Michael in his practice and was there for a couple of years working with him.
So you're exposed in the solution focus and narrative.
Mm-hmm.
So when you left BFTC and you took this other job, this counseling center, you said,
yeah.
So did you bring that into your practice and in your supervision?
Yep, absolutely.
And how receptive were they of that?
It was sort of mixed. I mean, the counseling center at the time, we had a real kind of eclectic group of volunteer supervisors who supervised teams of graduate students. And so, at the time in Milwaukee, in the Milwaukee therapy community, transactional analysis was popular, Gestalt therapy was popular. So, more psychodynamically oriented kinds of therapies were really popular. So I then was bringing, this kind of new and uncertain way of thinking about it, and people were intrigued by it, and it really made sense for the setting we were in too. I mean, given that the counseling was intended to be relatively short term, and so solution focused work just seemed to me to be a natural. I mean, it seemed like it made sense and would be the right fit for that type of organization.
Mm-hmm.
Yeah.
So in around 1991, you left sunny Australia?
Yep, and came back to Milwaukee.
Mm-hmm.
At that point, and again, it was before all, the cutting edge technology back then was a fax machine. So, we didn't have email and cell phones. I keep looking over here because I've got my cell phone over here. We didn't have these means of communication. And the truth is, I had a close family. I had lots of friends back in the US. And when I moved to Australia, I mean, it was very open-ended. I I kind of went there with the intent of I'm going to be there a while. And then, the reality of being so far away. And by then I was I was turning 32, and I knew at some point I wanted to be married and have a family. And interestingly, while I was in Australia, I had a few American women as clients who had married Australian men and struggled with being as far away from friends and family and things. And so some of the reality of that started to set in for me, and I had to kind of think to myself, okay, do I really see myself being here long term? And then my parents came to visit, and my mom, when she got off the plane, she looked at me and she said, Kate, I really love you, and I will never do this again. Meaning the very long plane ride. And I thought, okay, nice to see you too, Mom. But yeah, so with that, I ended up coming back. And I actually thought I was my plan when I returned to Milwaukee, I returned to Milwaukee because that was home. But at the time, I thought I was going to go on and do a PhD at Purdue University. And in fact, I went down there and I had done an interview. Michael Durrant and I, on one of our trips to the U.S., had actually presented to the trainees in their doctoral program. And so I was familiar with some of the faculty and things, and thought, okay, that'll be a good next step for me. But then life intervened, and in between, few months, well, actually 3 months to the day after I returned to Milwaukee, I met the man who is now my husband. And that kind of somewhat threw a wrench into my plan. And I ended up staying in Milwaukee, and no regrets there. 30 some years later, we're going strong.
He's not listening in, is he, Kate? Are you just saying?
No.
Can you imagine?
He's busy. He's busy.
Plug that one in.
So Kate, you were looking at a PhD at Purdue, and I take it was in family therapy.
Yep.
Because Purdue had and still has a graduate program in family therapy there, and have had some really good people there over the years.
They did.
But then you got married and created a family of your own.
Yep, exactly.
So what is it about this paper, this new paper that you have co-authored with a particular Australian person?
Mm-hmm.
But what is it that would interest people if they were to read it? And what is it about?
Well, it's a very personal paper in the sense that it's a case study that describes, and the Australian you're talking about is the wonderful David Haynes from Adelaide, and I happened to find him partially through all of you because he had done an FBS chat with you. But I also was aware of David. Well, actually, is it okay if I back up a little bit? Because just in terms of my own history, and it actually kind of plays into kind of what was unique for me about being involved with the paper is, so, then in the early 90s, I really stepped away from the therapy field and from, solution focused work and narrative work and all of that, and really stepped out of it. My career evolved into whole other direction. I got into more educational and administrative roles primarily I worked in higher ed, primarily in in medical education, and I worked in geriatrics education, and for the last 10 years in Alzheimer's education. And I ended up retiring from the University of Wisconsin in Madison, where I'd worked for about 14 years or so. And then because my family was moving to Fayetteville, Arkansas. So all of that is to say that I had been away from the solution-focused world for a good long time. And my primary connection remained through Eve Lipchik, because she and I continued to have this very close friendship. But really, in terms of keeping up with just how the field had developed, I was really out of the loop until a few years ago, kind of during the COVID pandemic. I decided that it was time for me to, I had retired from the university. We were now in this new location. I wanted to I wasn't really ready to be retired. And so I decided to go back and train as a coach. And what made sense to me was to do it, use from a solution-focused perspective. So I did Mark McCurgau's course, which is interestingly is based out of the University of Wisconsin-Milwaukee. And yet I was the only North American in the course. Everybody else was from Europe or Australia or somewhere else. But that really, and I took Mark's course with, well, just knowing his reputation, because I had attended the 2014 AAMFT conference along with Eve. It was held in Milwaukee that year, and it was a tribute to Insu and Steve and to BFTC. I had ended up attending that along with Eve, and then happened to go to a session that Mark McCurgau had done and thought, oh, okay, this is interesting, solution-focused work being applied in other contexts. And so I did that course, and then I went on to do 2 additional coaching courses with Kirsten Dierolf's group at Solutions Academy, which is based in Germany. But, given that we have Zoom and all these, ways of connecting now across the world, and that was really wonderful. And so over the past few years, I've been trying to catch up on all the developments that have taken place with solution-focused work over the past 30 years. And it's mind-boggling to me. I mean, I know when you all interviewed Eve, you asked her, could she ever have imagined how, solution-focused work would have evolved and developed, from where it started. And for me, it's just been, like I said, kind of mind-boggling just to look at all the different contexts and just this huge community of people who are using the approach now. So that is sort of a backdrop to this article with David. I had learned about him both through the FBS Chat, but part of that was all just my reintroduction into solution-focused work and seeing who was who and who was doing what. And so one of the things I did was to, just do a bit of Googling and research on what was happening in Australia. And so at the time, he was the president of the Australasian solution focus group. And what was intriguing about him, when my daughter had shared with me that she wanted to see a therapist again, and I had long felt like she could really benefit from seeing somebody, a solution-focused therapist. And now that we weren't restricted by geography, where we had to see somebody, she needed to see somebody in person in our local community, it opened up this whole world of possibilities. And one of the things that was really important to Maggie and the case study describes is she has, from the time she was born 10 weeks premature with many complications, has experienced lots of health issues throughout her life, has lived with chronic pain pretty much her entire life. She's had a lot of medical experiences and health issues. It was really, and with some of the previous therapists she's seen, had felt that had been somewhat undervalued or underappreciated, just what it's like to live with, chronic health issues. And so I knew that David was a nurse who had also was also a solution-focused practitioner. And so when I spoke with Maggie about that and was able to, show her some of either his writings or, his chat with you, that felt really comfortable to her. Like he felt like he would be the right fit, and he was. So David then approached me at sort of somewhere along the line of their working together to say, hey, I think there might be something here that could be of benefit to the solution-focused community. The work with Maggie, but also he was intrigued by my history with the early days of solution-focused work, and also now myself being a solution-focused practitioner in terms of being a coach. So that's kind of how the article came together.
And you might mention to anyone viewing this video that's in the Journal of Solution-Focused Practices, and it was just published, right? Just very recently published.
Last month.
Okay.
And I know David was quite, from what I've read, that he was quite nervous, the fact that, oh my God, it's Kate that I'm doing solution with her family. But it sounds like it's got a very, we've met David a few times, not in person, unfortunately, because of distance, but yeah, really like his down-to-earthness and approachability. Is that what came across?
Absolutely. To me, he embodies the solution-focused mindset. And, you could get into a conversation about, like, what does it mean to be solution-focused? And is it the questions you ask? Is it the, more technique part of it? But for me, it's really about the mindset. It's really about those underlying assumptions about client, about resilience and capacity and resources and strengths and non-pathologizing and, the problem being the problem, not the person is the problem, and all of those things. And, whether or not a person asks the miracle question or a scaling question or whatever, for me is not the most relevant piece. What's really most relevant is the way, those underlying assumptions are communicated. And I think, David is just really remarkable with that in a very human, very authentic, very, genuine, conversational way.
Mm-hmm. Yeah, and that sort of is consistent with Eve Lipchik's approach to it as well.
Absolutely.
Mm-hmm.
Yeah.
And Gil always reminds us, Kate, that the research tells us that it's the relationship with the person that's helping you that matters.
Yeah.
And apart from his taste in football teams, he's all right.
I wouldn't know anything about that.
He'll know what I'm saying. He'll know what I'm saying. So you went to Mark McCurgo's presentation and you went into coaching.
I
So how's
did.
that? What's happening there for you?
Yeah, I'm really enjoying it. And I mean, primarily right now, I'm working as a contractor with, a platform. I don't know if that's a term you're familiar with, but it's been fascinating. I mean, I love the variety of just the mix of clients that I'm getting to work with, and individuals that are interested in bettering themselves or their relationships or whatever in some way. So yeah, I feel very blessed to be able to do this, and in some ways it feels like life has gone full circle.
How do you see the difference between using solution focus in therapy as compared to coaching?
Well, you know what? To be real honest, I don't know that I see a huge difference. I mean, I think, obviously from a credentialing standpoint, and I'm an accredited professional certified coach through the International Coaching Federation, and there are obviously ethical guidelines around, drawing a distinction between therapy and coaching, and I'm very cognizant of those ethical guidelines. And I think how oftentimes that's framed is, that therapy is more appropriate for clients where there's like a significant mental health issue, or with clients that maybe need to sorry guys, I don't know what's going on with my screen there.
I mean, that was a pleasant surprise.
It
Sorry.
sure was.
Yeah, me too. Or, I think from an ICF standpoint, there might be some guidance around, if a client needs to sort of work through some past issues or trauma, or, something like that. But in the actual practice of coaching, it's very much about talking with people about their best hopes, about their preferred future, about their desired outcomes, what it is, how they want their lives to, or relationships or work situation, whatever it might be, to be different. And then, helping to guide the process forward. And so in that sense, I don't experience a lot of difference, if that makes sense.
I'm always curious about that. Yeah.
Yeah.
And I think we've spoken to Eve on a few occasions. I think I think she's amazed, like you were saying earlier, Kate, of how wide it's gone and how many different arenas and different areas. Saddened a bit that where it originated from, it seems to have grown more outside of its origin, where it started. In terms of why is the solution focused approach so good in so many different areas? What is it? What is the underlying stuff here? What makes it so usable in different arenas? Coaching, education, family therapy.
I think because, again, back to those underlying assumptions. And one of the things I always really appreciated at BFTC, and in how everyone talked about the approach, is that they were very clear to articulate the underlying foundational assumptions. And so, if reading Eve's book or reading things that Insu's written and Steve's written, and I know I adopted it in terms of the presenting and teaching that I would do, would to start off by being very explicit about what the underlying assumptions are. I remember when I traveled to Australia the first time, I did a presentation at Dulwich Center. They would have these Friday afternoons at Dulwich. And I was invited to do one and was really honored to do it. And I started the presentation by laying out what my assumptions were, and then describing a case and applying those assumptions and talking about how those assumptions were played out in the therapy that I was doing. And I think because the underlying assumptions are applicable, obviously within a therapy context, but also in other contexts, because it's about human interaction. It's about how we work together, because it's systemic by its nature. I think then it can be applied across different contexts. So, Joe, like you mentioned, I mean, in education, you can apply solution-focused principles in a classroom, in, guidance counseling, or in other, and then, as you described, in business and organizational work and coaching. So I guess, I mean, I'd be interested to know your thoughts, some of your thoughts. I mean, do you agree with that, or have other? I guess for me, it's because of the foundation, the mindset, and the foundational assumptions just are applicable across contexts.
Yeah.
Yeah.
While we still we got like a couple of minutes. Do you have any future projects?
Well, we do have this paper that we're working on, really celebrating and acknowledging Eve Lipchik's contribution to the development of solution-focused work. And that's very much in process at this point. And then beyond that, I'm going to see what else kind of evolves. I mean, one of the things, and again, thinking about Eve's contribution, and I know that you spoke with her about, her work in talking about emotion and the place of emotion in solution-focused work and things. And I found myself thinking some more about that, I don't know that there'll be a project involved with it, but I feel like there was historically maybe some misunderstanding about that. And I'm glad that Eve was very explicit in her writing and in her teaching, because I don't know, I think in the early days, solution-focused practitioners were accused of like ignoring emotion and things like that. And that wasn't necessarily my lived experience. I think what was different was, and especially at the time, there were a lot of therapy approaches that seemed to believe that in order to help people move forward in their lives, they needed to get in touch with their emotions, and that in a sense that the emotion was the vehicle toward moving forward, or to improved mental health or mental wellness or whatever. And I think solution-focused people, the folks at BFTC, didn't necessarily believe that. it's not to say that they negated the importance of emotion in people's lives, or that we aren't, as human beings, emotional beings. It just wasn't it wasn't necessary. It wasn't the primary vehicle for moving forward, if that makes sense.
Mm-hmm. Oh, definitely. Yeah, I can see that.
Yeah.
Do you have a last question, Aisha? Sitting there pretending to do admin.
Yeah, I just sit here, Kate. Honestly, I don't do anything. It's not a last minute question. It's more of a comment of how inspiring it is to listen to Kate talking about her journey in SF, and not just in SF, in her life, narrative therapy, and the choices she made to move to Australia at, a young age as well, in your early, was it early 30s? 32?
Yeah, right around 30.
Yeah, right. It's to drop everything and start again and be inspired by the people that you met there, and come back, and you've done so much, which has influenced so many people around you, whether you realize it or not. And I think from the conversation that you and I had privately on Zoom, I was saying backstage that I was so inspired. I was smiling for days, and I felt like I had one up on Joe because I spoke to you before he did. So for me, it's thank you very much, and we're going to have plenty more conversations, hopefully.
Yeah.
One last question, Kate. How prevalent is solution focus being used in Arkansas, especially Fayetteville?
Not terribly. People will call themselves solution focused, but it's become sort of just a much broader term than the context in which we would understand.
Yeah, I know what you're talking about. Yeah.
Yeah. So sadly not, and Joe kind of alluded to that that solution focus, that it's not necessarily being applied in the therapy context as robustly as it was at one point. Yeah, and but in the coaching space, it certainly is.
Mm-hmm.
I mean, the program that Kirsten Deroff has and her team have developed with Solutions Academy, I mean, I just can't speak highly enough of it. And it's a really, really impressive group, and they're really doing terrific work. So.
Well, thank you, Kate. It was lovely to meet you.
Yeah, great.
Yeah.
And I am so excited for you, Joe and Aisa, with your paper, and very exciting.
It took a while, because you can probably guess I'm not from an academic background. So, when you know what you want to say, but it doesn't actually, you're not referencing right and all that. And sometimes I think, oh, is this too much of a headache?
But you're learning that, Joe. You're learning.
Yeah. But
I was going to say that's true. But I was going to say you've had, because Joe wrote the paper. He wrote the paper. However, he was guided and supported by two of his mentors, Gil Green and Eve Lipchik, which and I know you read the paper, Kate, a while back, didn't you? Like the rough version of it. I think Eve sent it to you. So, being able to say that Gil and Eve have had an influence and made suggestions, and don't forget to highlight this and don't forget to do that, and have you read this and why have you done that? We're very lucky.
Yeah, extremely lucky.
Absolutely lucky. But while I have the platform, and Joe knows when I've got the mic, I don't shut up. Joe wrote the paper with the support of his mentors. I had nothing to do with writing the paper. I just want to completely say it out there. I did not write anything. It was all Joe. So he needs
But
to take credit for this.
Aisha, you did the brilliant creative clinical work. That's the basis of the paper.
But that to me is very easy. If I wouldn't be able to sit down and write that paper, I would have given up 100 times and gone, oh, I don't care. You know what I'm like, God. I'm going, oh, I don't care. But yeah, so thank you very much to Joe. And it all derived from one night in Amsterdam, sitting down and having a conversation. And here we are today.
Yep. Yeah.
So that was
and the
great.
work is tremendously creative. I mean, I was so inspired to read and to hear about the work that, the silent session work that you're doing. I mean, that is really something. Very cool.
You.
I can't wait to read it again. It's really inspiring.
The revised edition, times God knows what.
if you happen to be in Texas in January, Kate, maybe we'll actually meet in person.
Oh, well, there you go. Where in Texas are you going to be?
Oh, is that a secret? Are we allowed to say?
No, Fort Worth. Gil, are you coming?
If you guys and Linda will let me, I will.
Yes, done. Yeah,
okay. I don't want to get in the way. I don't want to get in the way.
No. How could you get in the way? No. But yeah, thank you, everybody. Any last words, Gil?
No, this has just been a delight. Kate, I first learned your name from that first paper I'd mentioned on domestic violence treatment. I read that paper years ago, and I reread it here recently. So it's just always been fascinated by the early days of BFTC, and you were part of that. And it's great to hear it from someone who was really there and part of it.
Yeah, thank you. I feel tremendously blessed. I mean, like I said, it was a life-changing experience professionally. I mean, I never would have gone to Australia, I'm sure, and had that, rich experience. And, the work that Michael and I did together was really exciting and interesting. It was such a wonderful time of, experimenting. We were looking at how we might. And I know now there's different opinions about whether you can kind of interweave solution-focused work and narrative and whatever, but that was really, it was just an exciting time and really creative. And then, like I said, the lifelong friendship with Eve has just been beyond words.
Well, your story of how you're developed professionally, and also your personal story reflected in this recent paper you did with David Haynes. It was just inspiring and just a great role model for other people and especially therapists and coaches, professionals doing this kind of work.
Thank you.
Thank you for your time, Kate. Like Gil was saying, I mean, a year ago, we'd never thought we'd be speaking to anyone from BFTC, let alone you and Eve. We're two small people from a little area of North London. So yeah, thank you so much. It's been thank you.
Yeah, you're like the new version of BFTC, doing this awesome creative work together. And yeah.
I'm going to need that.
You're right, Kate. I mean, they started their own nonprofit, their own charity. I mean, you're right.
Yep. So who knows
Gil's
where
always
you'll
waving
be.
the flag.
Who knows where you'll be in 10, 15, 20, 25 years.
I'll be retired, Kate. That's what I'll be.
Joe's not allowed to retire, and he knows that. No, I'm not signing that off. But thank you, everybody. Thank you for everybody for watching and the lovely comments. And we will see you soon on another FBS chat. And there's going to be more themed chats coming up soon. Take care.
Take care. Bye. Thank you.
Bye.